screen and stuff and act like I'm, applying. Like it's always 100 though, because I'm a ginger. So,
Don't tell anybody Brittany's on vacation.
oh yeah, I flew out to the islands. Uh,
Look at that.
Good morning, everybody. This is Brittany Jennings coming to you live from the Seniors Blue Book, and this morning we are over Zoom with Nafi Cunningham from Stratum Health Systems. Good morning, Nafi.
Good morning, good morning. Happy Friday, Brittany.
Happy Friday. A lot of people wear jeans on Friday, so since you can't see like below here, I'm wearing my jeans on top to kind of stay in suit with what people normally do on Fridays. So thank you so much for joining us. I know you must be incredibly busy, and it looks like you're working from home.
Yes, ma'am. I've been working from home this past few days, and it has been wonderful in one way, but getting all structured because it's different. Life is different from the hustle and bustle and running into the Britneys and everybody else and the hugs. And I'm having a little withdrawals, but
I know.
I
Me,
know, right?
me too. Like I'm one of those people where like if you don't like hugs, I'm sorry, I'm probably still gonna hug you. So yeah, I definitely miss hugs. I miss seeing everybody, and this is really cool. I've said this on a couple calls, like the way that we are connecting and still like we all truly, I think, like each other and we miss each other. And so finding ways to get creative and connect is definitely
Well,
awesome.
shout out to you guys, Brittany and the Senior Blue Book, for trying to still keep us all connected and informed in this very difficult time. So I truly appreciate you reaching out and also including me in this and letting us chat a little bit and share some information of what's going on despite this challenging times.
Absolutely. Well, I love having you around. If you could just be in my pocket all the time, like it's a sunshine pocket. Hey, quick question. So with everything, working from home, you said before we jumped on here, I think it's been like 4 days or 5 days at home now. What
Yeah.
what are you doing? Like, so obviously you're sitting and you're working from your computer, but what are some of the ways that you're kind of are you getting up and stretching? Are you doing anything to kind of relieve the cabin fever?
Well, one way is we're trying to stay connected with our colleagues as well, so doing things like this, online chatting, getting up, of course, and moving around a little bit is helpful. I can't just pop in somebody's cubicle or somebody's office like if I were in the office, but we're trying to stay connected online with colleagues. And at Tidewell, actually, the fun thing we're doing is now every Friday we do have a music therapist that goes on Facebook Live. So join us, everybody, today at 1:30 with Michael Russo. You can actually, it's very interactive. It had such a great time last Friday. And Facebook Live, you go in, he plays an instrument and he sings and people make their requests. And it is just so much fun because it is stressful right now
Mhm.
for everybody, for workers, the people are worried about a whole lot of things, whether it's your job, your finances, the situation, your loved ones. And we find it that, as you know, Tidewell is not just about the medical aspect of things, but we also do things within the community. How do we help folks in the community, in the facilities, in reaching just a little bit lightheartedness? And so this is a great way to utilize Michael's skills
I
and
love it.
share, yeah, and uplift people a little bit and share some little, a little moment of whatever, whether it's an hour or so of just people forgetting everything and just coming
Mhm.
together, singing and enjoying a little bit of some time. So today at 1:30, join us on Facebook Live on the Tidewell page.
That's awesome. I think music is one of those things that it's just magical because even it can change your mood from bad to good. It
Oh,
can if
God.
you're feeling like you're going through something, you can just throw on a country song and I'm sure it'll tell a
Yeah.
story about either your dog or your mom or your whatever it might be. But
And it takes you always back to your happy moment, I feel
exactly.
like. Yeah, so, get the right music there and whatever's going on, and you can just travel back in time to your happy moment. And that's what we want to do, and just uplift people just for a moment.
That's awesome.
Yeah.
So you mentioned Tidewell. We'll kind of retrace for a moment. So Stratum Health Systems, explain a little bit about the companies that are underneath that umbrella and kind of what your role is with Stratum.
So Stratum Health System is the parent company for Tidewell. That is one of the companies that are underneath that umbrella. And Tidewell is, of course, the most known of the many companies underneath. But we also have approved home health, and you work closely with Stephen. He's under that umbrella, and it's a private duty home health agency. And we have another company called Avidity Home Health. Now, Avidity, it provides skilled, it's a Medicare certified skilled nursing.
Mm-hmm.
So we can assist folks at home with whatever their needs may be, whether they need, physical therapies, social workers. If somebody has been diagnosed with, COPD, diabetes, and they need to manage all of that, we can help you all with that at home. So there are various ways, there are wide arrays of things that we can do for individuals wherever your needs may be in the medical, whatever your medical needs may be, and we can assist you with that. And the other one is Connexis Medical Services. Mm-hmm. And with Connexis, we have mobile doctors that go into the facilities to care for people. It is not hospice related, but we provide primary care, whether you need labs, your primary care can come take care of you at home because you might not be as mobile to be able to go to the doctor's offices.
So you really cover all of it.
Yeah, we're covering the whole continuum of care. Mm-hmm. So wherever you are with your medical needs, we can be of service to you. And as things change in life, which we do know that, as we get older and situations change, our needs change. So Stratum wants to be there to walk with you through that journey and be able to assist you and have that stability as well.
And as you're, with everything right now going on, you mentioned the words, and I've been saying the same thing during this challenging time. It's, finding new ways to be innovative, whether it's through, like if you're working from home, having staff meetings through Zoom. Let's talk about your patients, and has anything changed for them at home, or is it kind of just the same, everything looks the same as far as the care goes in the process?
Well, right now, the process slightly changed because of the fact that, we do have patients in facilities in the hospitals and things of that nature. And our nurses are able to go in and care for the patients that we need to. So that is the good thing, that, we are always an additional resource that can be added to whatever patient needs in the facility. Obviously, we have to respect the guidelines as well as, the requirements for, the buildings.
Right.
So to make sure that, everything is at point. So those are the things that we have to do. Our liaisons are not going into the building as frequently or unless they're requested. Mm-hmm. So normally before somebody comes into our services, we have to meet with family, do an explanation of service and all. But now we can do that over the phone. Mm-hmm. Or via, Zoom or whatever technology allows us, Skype and things of that nature. But if the family requests our presence, we are able to accommodate that as well.
That's amazing. And what about your grief, like the grief counseling? Because I know a lot of people, it's a free service you offer for the general public, and people need that. People are still, and even maybe more than ever right now, going through that process.
More than ever, even. These are difficult times. And our grief, we are not meeting just per CDC guidelines. Also, we're not encouraging groups of 10 or more. Mm-hmm. And because of that, we are not doing group sessions at this moment. However, we are providing one-on-one sessions, as well as we're providing phone sessions as well. So if somebody does need our services, we are definitely able to, answer their phone calls, or if they need us to meet in person, we can do that as well.
That's
so
amazing.
That doesn't stop. Life has changed. The way we do things have changed slightly, but at the core of everything, we are still providing that service that the people need it. We are doing wonderful things, not only for the community, but also to make sure that the staff that's working under these conditions are also taken care of.
Right.
That's what's so great about, working for this organization, because we're putting great support system in place for the staff so that they can be, emotionally and, physically, and all that components are intact for them to continue to provide this great service to our patients and our families.
That's an excellent point.
Daycare, we've opened up a daycare for those people because school is out. so that they have a place to take their children, in a safe place they can take
Wow.
their children. Yes, and so they can continue to go to work and not have to worry about their children being taken care of, because those are important things.
I
I
actually
have
had
a
that.
teenager, I don't have to worry about that at this point. But
Mhm.
if I had a 5, 6-year-old or even a 4-year-old, what to do. So to work for such an organization that thinks about its people and say, how do we make sure our patients are taken care of, but also how do we make sure that our colleagues are taken
Mhm.
care of, is wonderful.
Yeah, like and two things that come to mind from what you just said. Number one, the child care idea is brilliant. I had a call yesterday from a community, from a director, and asking, do I know any companies that are offering like private duty or anybody that's offering that kind of service because he wanted to take care of his employees' children. And you're
Yeah,
only, when I worked in assisted living, I always said this to my team, like I'm only as good, we're only all as good as the staff that's on the floor and how they are treating the residents,
absolutely.
patients. So taking care of them is such a huge, huge point. So I appreciate that you guys are doing that.
Yeah,
Um,
our leadership is definitely, yes, they cut my paycheck, but it's a wonderful leadership, and they do look out for us, and we definitely see that and feel that. So I'm grateful for that.
awesome. Well, are there any last words of, I always ask this, any last words of wisdom before we do end this wonderful Friday morning call?
Well, just the words of wisdom I have is just being gratefulness in this challenging times. We're grateful for the people who work for us, with us. We are grateful for our volunteers. We have a ton of volunteers who are
Mm,
going out and, making PPEs, masks and things of that nature to make sure that our people are protected. We have great volunteers that are still willing to come and help us out. So we're grateful for that, and just the unity and the support that everybody is doing right now, despite what's going on. It's a blessing, in staying positive and trying to stay as safe, as vigilant as we can, because I know it's difficult, but we will get through this together.
absolutely.
And so as we are figuring out ways to connect like we are right now and work together, and providing information still to those who need us, because unfortunately in the healthcare industry things don't stop, and we still have
Exactly.
to keep moving and providing the best quality of care we can under the circumstances.
Well, I really appreciate you joining us. You're always just so full of information, and I love listening to you. So we'll definitely have you back on one of these calls soon. And I
Thank
hope you have
you.
a fantastic weekend. And let's say this too. What's a good number? So if somebody's interested in services that you guys cover, so you mentioned you have Tidewell Hospice, you have Approved, which is private duty or in-home care. You have the Avidity, which is home health Medicare, and you have the Connexis, which is mobile physicians. What's the best number or way to reach out about any of those services?
Well, all of our services are the best. We have a centralized location, which is the access center, and they can transfer you to the appropriate department that you
Mhm.
need. So if you call us at 1-941 894-1777, and they can definitely get you to the right people that you need.
That's awesome. All right. Well, thanks again. I appreciate your time and virtual hugs to you.
Virtual hugs.
All right.
Well, thank you again, Brittany. You have a wonderful weekend, and I hope to see you soon.
I know, ditto. All right.
All
I'll
right.
talk to you soon, my friend.
Take care.
Bye.